Welcome! Let's get started. I'm Dr. Sean. I think all of you know that. I don't see any new faces in the crowd here. Our goal in the office, Dr. Bree and I, as chiropractors, is always to teach our patients that your body was meant to heal itself. It's made to heal itself. Does that sound familiar to all of you guys? It should, because we always preach it in here. That your body is an organism that was made to take care of everything on its own, function on its own, heal on its own. And we know that 90% of the problems that we have in terms of our health comes from things that we do to ourselves, okay? Certain interferences that get in the way from our body's innate ability to control and regulate everything and keep us healthy, okay? So there's some certain things that we do that cause interference. It gets in the way. If there wasn't anything that ever got in the way, you'd never be sick, you'd never have to go see a doctor, you'd never have any problems, okay? But there are things that get in the way, there's interferences, and 90% of those are avoidable. They're due to lifestyle. Only about 10% is due to actually being dealt a bad hand of genetics, is what research has found. So when we talk about the interferences that get in the way, this is what I'm talking about. Over the last year or so, I've been preaching these 5 essentials, and the interferences that get in the way are what? Stress, negative mind, right? Improper nerve supply, or you have nerve interference, that's where chiropractic comes in. Bad nutrition, not enough exercise or no exercise, and overabundance of toxins in our system. It always boils back to those 5 essentials. So tonight, the topic is heart health, preventing heart disease, having a healthy heart, right? But I don't want you to lose sight of the big picture, okay? I want you to understand the big picture, even though, yes, we're going to talk about heart health tonight, but the tips that I'm going to talk about and the things going on, they pertain to your overall health, not just your heart, okay? And every month when we have one of these workshops, it always comes back to what? Those 5 essentials. I always talk about those. If you can master those 5, you remove the interferences and you allow your body just to operate the way that it's supposed to, okay? So let's talk about heart health. It's a topic tonight, and in here we're going to be looking for 7 steps to dealing with cholesterol, blood pressure, heart disease, okay? I want you to be able to come away with those. So there's some devastating statistics. I like to start out with statistics often, not because they're necessarily that interesting, but it really gives you an idea of how big of a problem some of this stuff is in our country. So you look at this, 1 out of every 2 people die from heart disease. So you look around the room, half of us, we're going to die of heart disease. Stroke or heart attack is going to kill us. 1 out of 2. That's half us. That's a lot. 25, and it's not only older people that this is affecting. The studies have shown that it's affecting us at a younger and younger age. Again, a lot due to diet and lifestyle. Our kids aren't eating well and they're not moving. But look at this. 25% of children that are 5 years and older already are showing signs of plaque buildup in their arteries at 5 years old. And it's not gonna get better as they age, right? It's only going to get worse. 60% of our teenagers, 15 and 19-year-olds, 60% of them have plaque buildup in their arteries. Their coronary artery, that's the artery that goes right to the heart. If that thing gets blocked, your heart's not going to work anymore. I mean, these are young people. 79 million Americans have heart disease. Staggering number. 871,000 deaths per year in the United States from heart disease. Cancer only kills about 550,000. So heart disease is way worse than cancer. So here's a myth. How many of you think that things like heart disease, having high blood pressure, high cholesterol, getting heart attacks, is a normal part of aging? It just comes with aging. Nobody raises their hand, right? Because you're already reading the slide. You see that it's a myth. But a lot of people think that, or we just have that as a common idea in our society that that's normal. As we get older, it's normal to have these problems and to need to be medicated for them. But it's not normal, okay? We want to bust that myth. The truth is that yes, it's very common Very common, but there's a difference between being common and being normal. It's not normal, okay? There's a difference. So the true answer here is prevention, okay? You hear a lot about people being on prescriptions for high blood pressure, prescriptions for high cholesterol, or they had a heart attack, you know, going in for triple bypass surgery, whatever it might be. Those are all treatments, okay, once you already have a problem. And many times at that point it might be too late, or there's already a lot of damage done. The real key here is prevention, and that's what we always talk about no matter what the topic is. We'd rather prevent it rather than have to treat it, right? I think we all agree that preventing is easier and better than treatment once we already have a problem. So that's what we're going to talk about today, and that's what we're going to focus on, is preventing heart disease. So there's a picture, a real simplified version of your amazing heart. The job of your heart is to pump blood throughout your entire body, to every single cell, every tissue, every organ. Carries blood, oxygen, nutrients. That's what your body needs to operate, move around, do everything. If it doesn't get it, it won't work. To show you how amazing it is, your heart pumps 7,200 liters per day. And if that doesn't mean anything to you, because it doesn't mean anything to me, 7,200 liters, it's enough to fill the average car gas tank 180 times a day. That's how strong and amazing your heart is. You can fill your car up 180 times. Only if it would actually do that, right? Save a lot of money on gas. So let's get into this. Let's talk about cholesterol. I'm sure we all know people who are on a drug for high cholesterol. Maybe we're on drugs ourselves for high cholesterol. So first of all, let's talk about what is cholesterol. Cholesterol is a waxy substance in your body. It's made predominantly by your liver. You might not have known that because we always talk about food sources of cholesterol. Decrease your cholesterol, you know, cholesterol is a bad thing. But the truth is 80% of the cholesterol in your body is made by your liver. And it's supposed to be there. It's not a mistake that your liver made it. It's supposed to be there. It's for many vital functions in your body. It's called LDL and HDL. Those are a couple different names for them. Those are very common terms. You've maybe heard of them. LDL is known as bad cholesterol, right? And it's termed that because what it does is it carries cholesterol from your liver to different areas of your body. Like, for instance, since we're talking about heart disease today, to your arteries. It'll carry cholesterol to your arteries and then deposit it there. So that's why it gets the nickname bad cholesterol. Even though understand that LDL is normal. It's a part of cholesterol that's produced by your liver, and it serves a function. It carries cholesterol everywhere in your body for vital functions, okay? I want you to start to get the idea that cholesterol isn't all bad. It's been given a bad rap, but it's very important at a certain level in your body. The HDL, which is known as good cholesterol, we want that one to be high, right? We want that to be high because it's called good because what that does is the opposite of the LDL. Okay, the LDL, remember, it takes the cholesterol from the liver and it transports it to the heart or to the vessels everywhere in the body. The HDL does the reverse. It takes the cholesterol from the arteries and takes it back to the liver to be recycled or to get rid of it. Okay, so that's why in medicine we typically refer to HDL as good cholesterol because it takes cholesterol away from your body back to the liver. Make sense? Yeah, alright, very good. So, we talked about cholesterol is important. Here's a few things that it does. Cholesterol is needed to manufacture hormones. Hormones are those little chemical messengers, they're little molecules that transfer throughout your body, communicating between one part of the body to the other. Maybe the brain with an organ or another organ with the brain. It's chemical messengers so that your body can talk to itself and let each other know what's going on. Okay, so those are very important. Those are hormones. Bile acids. Cholesterol is important in making bile acids. Bile acids are important for helping you digest fat properly. When you eat a meal that has fat in it, to digest it properly, you need bile acids. If you don't have enough bile acids, oftentimes you'll have indigestion or stomach problems when you're eating fatty foods. And vitamin D. Cholesterol is important in vitamin D. I'll bet you that most of you in this room know that if you go outside in the sun, you get vitamin D from that, right? You do. your body synthesizes vitamin D when it's exposed to sun. That's why it's important to be in the sun, at least a little bit. But most of you probably didn't know that when the rays from the sun hit your skin, what it has to hit is cholesterol to make vitamin D. If there's no cholesterol there, it won't make any vitamin D. It's the sun ray hitting the cholesterol on your skin makes vitamin D. So cholesterol is extremely important for vitamin D. It's essential. And vitamin D is essential for human health. Really important in your immune system and good bone health. So you can't make these things if you don't have cholesterol. So we certainly don't want to lower cholesterol too low. So the real question here is, does cholesterol cause heart disease? I just told you how important cholesterol is. So we know that we don't want to get rid of it. But the question is, does it cause heart disease? And the truth is that, pay attention, it's not the cholesterol that causes the heart disease. Okay? Just cholesterol by itself will do its thing. It'll travel from the liver to the arteries to all the cells, do what it's supposed to do, it'll travel back, no big deal. It's not the cholesterol, it's the oxidation of the cholesterol, when it becomes oxidized, which is when it reacts with oxygen, the chemical reaction that occurs. So, just to keep it simple, I want you to understand it's not the cholesterol, no matter how high or low, that's not what causes heart disease. It's the oxidation of the cholesterol which causes heart disease. And we'll talk a little bit more about that in a little bit, but to give you a little bit better understanding of what I'm talking about when I say it's the oxidation of cholesterol, here's what happens. I'm going to tell you about the story of oxidizing cholesterol and how it affects the arteries. So, when cholesterol gets oxidized, it becomes reactive, meaning that it will cause problems in the body. If it's not reactive, it'll just do its thing and it won't piss anybody off. Okay? But when it's reactive, it pisses things off. See, if I use words like piss, then it gets your attention because, like, the doctor said piss. But when it's reactive, it becomes oxidized and it's reactive, it irritates areas in your body, okay? It becomes reactive. Now, it'll go through your vessels and it will actually cause little nicks, little damaged areas. These electrons will cause these little damaged areas. So now you have a damaged spot in your artery and the cholesterol that's reactive will come and stick to it. Now we're starting to have a problem, okay? Just the cholesterol alone would have done its deal. But once it becomes oxidized and it's reactive and it causes nicks in the artery, it will start to stick to those areas. Okay? Keep it as simple as I possibly can. So to drive this point home, if you're still not quite sure about what I'm saying, is cholesterol good or bad? Should I worry about it? There have been studies that have shown that when you take people who have high cholesterol and you compare them to people who have low cholesterol, it's the people that have low cholesterol that are having more heart attacks and dying more from heart attacks. I didn't say that wrong. It's the people that have lower cholesterol that are dying from more heart attacks, having more heart attacks and dying from more heart attacks. You might think that's a little odd, huh? I'm not saying that drugs don't work to lower your cholesterol. They do. But what I am saying is the studies show that that doesn't matter. Even though you're lowering your cholesterol, it doesn't mean you die less of heart attacks, doesn't mean you have less heart attacks. In fact, the studies have found the opposite. The lower your cholesterol is, the more likely you are to have a heart attack, the more likely you are to die of a heart attack. That should surprise some of you, because I'm guessing you probably haven't heard that before. So, cholesterol is an important part of the body's repair substance. So, whenever there's a damaged area, your body will produce more cholesterol and send it to that area to try to repair it. Whether it's an artery, or you sprain your ankle, or whatever it is, okay? It's important for your body to be able to heal. So if you're not convinced yet about cholesterol medication, okay, we've already set up the idea that it really doesn't help us reduce the risk of a heart attack or dying of a heart attack. So what's the point? If that wasn't bad enough, take a look at the risks or the dangers, the side effects with typical cholesterol.